Hello, my name is Joe Poor. I'm an RN, BSN, and I am a nurse manager of the Outpatient Surgery Department and Endoscopy Center in a 230-bed acute care inpatient hospital in Council Bluffs, Iowa. Technology has changed the way nursing and other healthcare disciplines practice in so many ways, especially over the last 8 years since the Health Information Technology for Economic and Clinical Health HITECH Act was passed in 2009. Integration of technology related to health records and data entry has allowed for better, more effective, and efficient care with better results. The integration of technology has allowed nursing and other healthcare entities and ancillary departments to better serve patients and being more efficient and effective in communication, decision support, results management, order entry and support, and many others. This according to Nelson and Stagger's 2018. Healthcare providers are able to get results faster, have orders put in a more timely and legible manner that takes out any potential guesswork. It allows real-time results and less busy work by staff, faxing and calling in other areas looking for patient information or results. From a patient standpoint, it allows patients to better control their own health care. They are able to access online records and be integrated into the system that allows them better access to their provider or providers when necessary. Because of the electronic health record, access to patient charts is much more accessible to all healthcare providers, which makes it extremely convenient and efficient, but also poses a risk that access is extended to people who have no business being in a record that they may have access to. Once an unauthorized person gains access to a record or other patient identifiable information, breach of privacy and confidentiality occurs. One of the biggest regulations that has gone through some upgrades since the emergence of electronic records is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act that was enacted in 1996 and went through an upgrade in 2003. In part due to the realization that technology would impact healthcare in many ways and there needed to be better protection. This from Weiner and Gilliland, 2011. The idea behind HIPAA is twofold. One, it provides protection of health information in terms of privacy and confidentiality, and provides more security that was related to pre-existing conditions and the ability to attain health coverage after changing jobs. Essentially, that part of it prevents potential employers from asking health-related questions for insurability purposes. This all applies to the use of and disclosure of protected health information. This according to Hayter and Brown, 2010. HIPAA regulations apply to health plans which are entities that pay for or provide for health care. Healthcare clearinghouses, which are organizations that receive and process health information, and healthcare providers, which are all entities that provide healthcare services. This according to Weiner and Gilliland, 2011. Not only are health records subjected to HIPAA, but also patient identifiable information is protected, and this is known as protected health information and includes things such as the PIN number, address, photo, email address, and many others. This according to L. Mammon and Mower, 2013. There are no statute of limitations on how long information is to remain confidential and private. In part, this is due to protect and respect the privacy and confidentiality of the deceased and their family. All entities that fall under the guidelines of HIPAA regulations must provide notice of privacy practice to every patient. This according to Weiner and Gilliland, 2011. A few examples of HIPAA violations would be a nurse seeing that her neighbor has come in for surgery, even though that nurse is not taking care of that patient, she still accesses that neighbor's chart to see what she's having done and why. Another one that I see from time to time in my area deals with law enforcement. If a person who is a known felon wanted by law enforcement comes in seeking treatment at our healthcare facility, if no crime has been committed, we are not allowed to tip off the law enforcement agencies to let them know that that patient is in our facility. Other HIPAA violations that probably occur often, but most often go unreported, are things such as texting results to providers. This is an unsecure method in which cybercriminals may gain access to health information, and things such as leaving patient identifiable information uncovered in areas where others may have access to them is also a privacy violation. HIPAA pertains to privacy, confidentiality, and security of information, but the greatest risk is patient privacy and making sure that information is protected. Patient privacy is restricting access to personal information and deals with the collection of and use of personal information and how that information is to be distributed based on patient authorization. That according to Rothstein 2013. According to Nelson and Stagger's 2018, patient privacy deals with people and access to their information, use of and disclosure of, and keeping personal health information private, and preventing and checking for breaches and inappropriate use. Theody 2010 explains that patients are allowed to ask up to 6 years back of who all has accessed their electronic record for privacy issues if they feel there may have been a breach in privacy. When the patient consents to release of information, that is not a break in HIPAA and privacy, but private information can at times be given out without the consent in some situations. Some of those situations in which healthcare providers are legally protected when having to break patient privacy include when the patient's best interest is at stake. That could be related to health conditions that risk life, limb, or eyesight because the patient may be unable to communicate their own wishes. Or, as mentioned above, for the prevention of or detection of a crime, law enforcement can be called if a crime was committed, and that patient that's in there can be reported and detained by law enforcement. This reported by Theody 2010. Though electronic records have made it somewhat easier to breach privacy and confidentiality, the benefits of the electronic health record far outweigh the risks. This goes for those who access to charts and informatics that create pathways to collect data from the records to make sure that no patient identifiable information is extracted. Knowing what HIPAA is and how to distinguish between confidentiality and privacy, and knowing what a breach is and integrating the use of technology to reduce the occurrences of breaches and educating staff of proper procedure can make electronic health records much more secure. I hope that this was educational and informative for you. Thank you for your time.